Good afternoon, everyone, and welcome to day 3 of the Urban Health Institute's annual symposium on social determinants of health. It's entitled Building and Restoring Health in Communities, Understanding and Building Partnerships to Advance Health Equity. My name is Dr. Lisa Cooper, and I'm a Bloomberg Distinguished Professor of Equity in Health and Healthcare, as well as Director of the Urban Health Institute here at Johns Hopkins. And as we've said over the last couple of days of our symposium, there has never been a time that's been more critical for examining the relationship between social determinants and health, whether it pertains to surviving a global pandemic or dealing with America's reckoning of racial injustice. This is a time when we can all engage in advancing health equity. So on behalf of UHI and the Office of the Provost, it's a pleasure to have you join us here today. Now, to provide us with some opening remarks, I'd like to introduce Dr. Josh Sharfstein. Dr. Josh Sharfstein is Vice Dean for Public Health Practice and Community Engagement at the Bloomberg School of Public Health. He is a former Health Commissioner of Baltimore, Principal Deputy Commissioner of the U.S. Food and Drug Administration, and also former Secretary of the Department of Health and Mental Hygiene for the state of Maryland. He's a pediatrician by training, and he lives here in Baltimore City. Welcome, Dr. Sharfstein, and thank you for joining us.
Thank you so much, Lisa and Dr. Cooper and colleagues, for inviting me to say a few words to kick off this third day of building and restoring health in communities, the Social Determinants of Health Symposium from the Urban Health Institute. Day one was all about employment. Day two was all about education. Both were incredibly engaging and inspiring. And now we're going to talk about food. One second. Specifically, we're going to talk about food insecurity, which Feeding America defines as a lack of consistent access to enough food for every person in a household to live an active, healthy life. Food insecurity is a major social determinant of health. People who do not have enough food to eat are at risk for many types of health problems. These include anemia, anxiety, asthma attacks, behavioral problems, dental cavities, and depression, and diabetes. And that's not even the whole list. That's just A through D. Food is essential, and there are many different pathways by which food insecurity makes you sick. You can see even from this short list that food security is essential for both mental health and physical health. And there's also evidence that inadequate access to food can lead to other risky behaviors, particularly among young people. Food insecurity has been a major problem in the United States for many years, reflecting high rates of poverty and their major disparities, including by race and ethnicity. And then came the pandemic. Many people lost their jobs and incomes. Millions of American families had to choose between basic necessities for their homes like heat and feeding their children, and the results were catastrophic. This graph from the Brookings Institution shows a huge spike in food insecurity, including kids not having enough to eat as a result of the pandemic. That's the point there by the arrow. Massive government investments have helped a little bit, but the problem remains far worse than before the pandemic. This is a really just horrible tragedy and consequence of COVID-19. And here's the breakdown by race and ethnicity of that first surge in food insecurity. By far, the highest rates of food insecurity happened among African American and Hispanic households. Those are the two top lines on the graph. I want to close with the definition of public health. What we as a society do collectively to assure the conditions in which people can be healthy. The key words there are we, society, and collectively. As you'll soon hear from this terrific group of speakers, there's a lot that Baltimore has done to address food insecurity during the pandemic, a lot that's been done as a society collectively, and there's a lot more that we can still do together. These aren't just important food efforts, they are vital public health efforts. So Dr. Cooper, to introduce the great panel and the plan for today, I'll turn it back over to you.
Thank you, Dr. Sharfstein, for that excellent introduction to today's program. And thank you so much for reminding us about the importance of our entire society being involved in this issue and working collectively, as you've said, and the importance of food as a social determinant of health. One of the objectives of us hosting this annual symposium is to strengthen existing relationships and also between Johns Hopkins and other academic institutions and community partners that work together to reduce health inequities that impact Baltimore's residents, as well as those of many other US cities. As Dr. Sharfstein mentioned yesterday, we heard from educators about the impact education has on health. The day before that, we heard a lot about the impact that employment has on economic justice and health. And today, we're going to focus on food as medicine, the role of food access and food justice in meeting basic nutritional needs as a precondition for achieving health equity. So let's go through some housekeeping items. Actually, first, before we do that, I'd like to acknowledge Indigenous and racial inequities by reading through this statement. We acknowledge that Johns Hopkins University and our schools are on the traditional and contemporary lands of Indigenous peoples. Our campus is on unceded lands of the Piscataway and Susquehanna people. Today, there are more than 7,000 Indigenous peoples in Baltimore City, including members of the Piscataway, Lumbee, and Eastern Band Cherokee. We acknowledge the history of oppression and systemic inequities while representing all tribal nations' sovereignty. We strive to do our own work to address the inequities and disparities that Black, Latinx, Indigenous, and Native American persons, Asian Americans and Pacific Islanders, and other persons of color, members of religious minorities, LGBTQIA persons, persons with disabilities, and persons otherwise adversely affected by persistent poverty or inequality experience, while expanding partnerships with and following the lead of these communities. Now, next, we will go to some housekeeping items. This presentation is being recorded and will be shared later. There are going to be live captions that are auto-generated. For the Q&A, please enter your questions for the presenters in the Q&A window only. Questions will be answered live or with short typed responses. Please click the thumbs up button to bring popular questions up to the top of the Q&A window. The chat will be made available during the panel discussion for reflections and open dialogue. If you'd like to pose a question to one of the panelists, please use the Q&A window only. And for our pleasure and enjoyment, we have had graphic recording throughout this week activities. And so today, we are again pleased to have Ms. Lauren Green from Dancing with Markers, who will be using graphic recording as a reflection tool to capture the high-level takeaways from our discussion today. Next slide. So please stay connected during the symposium by using our taglines, by tagging our speakers and panelists, and by using the hashtag SDH2021. The mission of the Urban Health Institute is to advance health and health equity in Baltimore by facilitating and recognizing collaborations between communities, universities, and healthcare delivery systems, government, and the private sector to build collective capacity for achieving health equity. Mobilizing resources in support of promising strategies to achieve substantial gains in the health and well-being of Baltimore residents, and advancing understanding, dialogue, and trust to create pathways to health, well-being, and social justice in Baltimore. Now, our second goal actually is really the support for achieving substantial gains through strategic consultation grants. And I wanted to make sure to make note of the fact that Ms. Holly Freistadt, who is Food Policy Director and Chief of Food Policy and Planning from Baltimore City, whom you will hear from later today, was among one of the first recipients of our strategic consultation grants. In partnership with Susan Gross from the Bloomberg School of Public Health, they worked together on evaluating food access and diet quality of adolescents from SNAP households in Baltimore City. So we are going to be releasing our next cycle of strategic consultation grants. So please stay tuned and sign up for our list. Now, next, I'd like to share with you photos of our UHI team. Of course, without this incredible team, none of this work would be possible. So their photos are displayed on this slide, and I'd like to take a moment especially to thank Dr. Rachel Thornton for her leadership of this program. I'd also like to thank our other associate directors, including Dr. Kendrick Gwynn, for his contributions to planning the program in partnership with our community leaders. And certainly last but not least, I would like to thank Imani West, Natalie Wiggins, and Nancy Edwards Malello, I'm sorry, for just their incredible support and leadership of this program. I can't say enough about this amazing team. We've had so many outstanding community-based organizations and governmental agencies that are already promoting health and well-being in Baltimore. And with our grant programs, we are thrilled to be able to support organizations and agencies to further advance their missions through partnerships with the faculty and students who are able to offer their innovative research approaches and their technical grant support. So we have a very exciting agenda for you today. We've also already gone through our welcome and opening remarks. Next, we're going to have some healing artistic events for you. We've enjoyed these every day this week. And, as we've talked about before, arts are a universal language that create community and give voice to the voiceless, and with many healing properties. And so we are so thrilled to be able to bring to you some spoken word from Nydia Williams, a musical performance by one of our students from the Peabody Institute, Leora Willinger, and Bites on a Budget by Brandon Bowden, who is a nutrition and integrative health educator and also one of Urban Health Institute's very own Bunting Fellows from 2019. We'll follow that with our panel discussion, and then we will have questions from the audience, followed by our graphic recording artist who will give us the opportunity to share our reflections. So we look forward to an exciting program today. And now I turn over to our artists.
Hello, my name is Nia Williams, and I'm a writer and performing artist born and raised in Washington, D.C. I am so excited to be here with you today at the 2021 Social Determinants of Health Symposium hosted by the Johns Hopkins University. It is a privilege to be here, and I'm very grateful to the organizers for inviting me to be a part of this. Today, I will be sharing with you a poem entitled Hunger, which speaks to the issue of hunger, not only here in the District of Columbia, but in the world at large. So often when we think about hunger in the hunger crisis, we think about it as the fault of an individual or the incapability Hello, my name is Nia Williams, and I'm a writer and performing artist born and raised in Washington, D.C. I am so excited to be here with you today at the 2021 Social Determinants of Health Symposium hosted by the Johns Hopkins University. It is a privilege to be here, and I'm very grateful to the organizers for inviting me to be a part of this. Today, I will be sharing with you a poem entitled Hunger, which speaks to the issue of hunger, not only here in the District of Columbia, but in the world at large. So often when we think about hunger in the hunger crisis, we think about it as the fault of an individual or the incapability of a community to sustain itself, when in fact, hunger and persistent hunger, as we see it today, points to the systemic and institutional issues that have plagued our society for hundreds of years. So I hope that this piece gives you an opportunity to think critically about how you perceive hunger, but also embolden you to take action and to make some changes in your own life and how you think about it so that you can make a difference with those around you. Food is no luxury or gift, no tool of humbling destruction. Food is a home of heritage, a reclamation call from dust to dust, bone to bone. My hands have lived 1,000 lives, turned 1,000,000 stones. For in each crumb planted in my body, ancestors have found their way home. The storms that saturate our existence, make us question our minds, are an invitation to quell the fire, climbing the top of our bloodline. Listen to the soil, honor its fertility. Life remains in our reach, a lingering taste of vitality. The time has come for us to own our destiny, and with each other, we can harvest infinitely. The blades of our past ignorance are here to stay, but the promise of a fuller belly lingers in the vision of a brighter day. Thank you so much for taking the time to listen to my piece. Again, I hope its words encourage you to think critically about how you perceive hunger and what it is that you can do right now to make sure that you're doing your part in getting food and resources to everyone who needs it, regardless of what they look like, where they live, or what they've been through. Thank you so much again. If you'd like to talk about this piece or talk about food justice more in depth with me, feel free to reach out to me on social media on Instagram at Nia Williams. If you're interested in looking at more of my work or purchasing my chapbook Cotton, you're more than welcome to visit my website, niawilliams.com. Thank you so much and enjoy the rest of the symposium.
So I think we're having some technical challenges, but I'm glad you were still able to enjoy the spoken word, even though we couldn't really see the film. I guess our visuals don't want to cooperate today. But fortunately, we can still enjoy the music.
Hey y'all, it's me, your favorite nutrition educator, Brandon Bowden, aka Filtered Food, and I've been challenged to build a nutritious and delicious dinner for less than $5. And since we can't be together right now, I decided to bring you guys along for the ride. Let's go. We're here in the McElderry Park neighborhood already, so I'm going to head over to the Save-A-Lot on Monument Street to do my shopping. Unfortunately, almost 40% of the households in this area are bringing in less than $25,000 a year. So I'm working to share tools like these with you all here at the Symposium, but also with folks in the community who want to shift to a more healthful diet themselves. We are here, but before we set foot in an aisle, the first thing we want to do is check the sales paper to help guide our meal selection. I want to get the best nutrition bang for my $5, so I'm going to focus on whole foods, lean meats, and whole grains. It looks like the family pack of pork chops is $2.99. And there's this 90-second brown rice and the 99-cent California medley. I'm not sure how big the meat packs will be, but we may have a winner pork chop dinner here, folks. Let's see. Now we have a plan and we are ready to shop. The number one rule that I share after not shopping hungry, or in some cases hangry, is to shop the perimeter or the outside of the store first. That's where you find your most nutritious and least processed foods like fruits, vegetables, nuts and seeds, dairy and eggs, and lean cuts of meat. You should be dipping into the aisles only for your staple pantry items like rice or seasonings. Having a plan does help, but sometimes you are just too late for the sale. That's right, you guessed it. There are no pork chops, so we need a plan B. If you find yourself in a bind like this, go back to the plan. Remember your budget and substitute whenever necessary. This Italian sausage is a little more expensive than we planned, but maybe we can squeeze in under budget. And just like that, we're back on track. Around the corner, we found the California medley, bringing some color and important vitamins into our dish. And last but certainly not least, we'll step into the aisle to grab our 90-second brown rice to finish out the dish. This is going to add calories, B vitamins, and some much-needed minerals to our plate. Here we are, folks, with the moment of truth, and looks like our Italian sausage put us 87 cents over, and we are busted. Well, everybody, it looks like we're headed home hungry, but we are not defeated. Now, it's the perfect time to think through how to pull this meal together. The ingredients are rather simple and can really be thrown together to make a one-pot dish. You simply choose a protein for flavor, add a whole grain base like rice or pasta, and throw in a couple of veggies and you're good to go. Today we're going to cook our sausage, season our veggies, and fold both into some brown rice to make a delicious sausage and rice bowl for us to have for dinner. Let's get to the kitchen. Fortunately for us, there's no major prep in the kitchen today, so we can just jump right in. First, warm a pan over medium heat, and when the pan is hot, add about 1 to 2 tablespoons of oil. I actually like to brown my sausages for a couple of minutes on multiple sides, and then add a little bit of water to steam them for about 10 minutes until they are cooked through. One-pot dishes usually focus on meat as flavor and not the focal point of a dish. This can actually change the way we think about building meals, so today, we're cooking our veggies in the same drippings and oil from the Italian sausage pan. Frozen veggies are great because they're picked at their ripest and partially cooked before they're frozen, so they're a great source of nutrients but don't really need to be heavily cooked. This veggie medley is actually a great source of fiber, vitamin C, and vitamin A. These are all great nutrients for digestion and immune support. We're going to work on punching up the flavor of our veggies by adding in some coconut oil, lemon juice, about a tablespoon of garlic powder, a couple teaspoons of onion powder, and a half a teaspoon of oregano and parsley. I'm going to add in a pinch of pepper flakes at the end for some spice, and then of course we're salting and peppering to taste. This 90-second brown rice is also pre-cooked, so we just need to warm it a bit before we add in the other ingredients. No need to worry, this 90-second variety is still a great source of whole grain. You can punch up the flavor of your brown rice by adding in low-sodium vegetable broth instead of the fourth a cup of water when warming it. Now that everything is cooked, let's put it all together and let those flavors dance. And just like that, our sausage and rice bowl dinner is complete. This one-pot dish serves 3 to 4 and can be frozen or stored in the fridge for up to 3 to 4 days. I want to thank you all for joining me on this adventure today. Didn't know what we were getting into, but I am sure ready to eat. Although I wasn't successful with the $5 challenge, we still made a nutritious meal for under $6. I hope that I offered some helpful tips for you on your journey and something useful for you to share with your community. Thank you for joining me, your favorite nutrition educator, Brandon B., aka Filtered Food for Bites on a Budget. Have a great day.
Well, thank you for those really inspiring words, the beautiful music, and also the demonstration. My name is Dr. Deidre Cruz, and I'm a kidney physician or nephrologist and professor of medicine at Johns Hopkins. And I also serve as Associate Director for Research Development for the Johns Hopkins Center for Health Equity. And I am someone who has an interest in how food insecurity impacts people living with kidney disease or living with high blood pressure. And I am so delighted to be moderating our panel today, which, as you've heard, is titled The Role of Food Access and Food Justice in Meeting Basic Nutritional Needs as a Precondition for Achieving Health Equity. And so today we're going to hear from 3 experts in really in food itself and also in food policy and also food justice. And we're generally going to be having a conversation surrounding the topic of, how can people actually access food and how can they utilize it for their optimal health? And so I'm really excited to introduce our 3 panelists today. We have Ms. Holly Freistadt, who is the Food Policy Director and Chief of the Food Policy and Planning Division at the Baltimore City Department of Planning. We have Ms. Arlene Taylor Dawson, who is a research associate and dietitian at Johns Hopkins Medicine. And then we have Ms. Atia Wells, who is executive director of Backyard Base Camp at Bliss Meadows and is an Urban Health Institute Bunting Neighborhood Leadership Fellow for 2021. And so I really want to just first start off by inviting each of our panelists today to introduce themselves and tell us sort of what brought them to this work. And I think we'll start off with Ms. Freistadt.
Hi, good afternoon, everyone. I'm Holly Freistadt. The motivating factor of what brought me to my work has really been my mother. I grew up with my mother chronically ill and quickly realized I may not be able to change her health, but I could change my health and I could change the environment. So I studied nutrition. And from learning about nutrition, I got really interested in farming and growing food. And the culture of food. And so from one grant to the next grant led me to really looking at the food environment and that programs are great, but a lot of the programs bump up against policies. And if the policies don't change, then the neighborhoods can't change themselves either. So that's what really brought me in the progression from nutrition to agriculture to programs to policy. It's great to be here today.
It's great to have you. And Ms. Dawson.
Hi, my name is Arlene Dowson. What brought me to this work is, again, somewhat related to my mom. I grew up in a single family home in the 60s in Northwest Baltimore. And my mom worked full time. And because of her job, but probably more so her lack of interest in food and food preparation, it was the 60s. So we ate a lot of TV dinners and canned vegetables. And I like to say that I think my brother and I survived our childhood eating the deli foods that our grandfather brought home to us after school. And I love sweets and taught myself how to bake. And it really wasn't even until high school that I first tasted homegrown Maryland tomatoes. And when I went to college, I was ill prepared to make healthy choices in the dining hall. And it was in one semester where I lived and ate in a food co-op where I was the menu planner. And at that job, I really learned the importance of planning out weekly meals and organizing the cooks, the student cooks, to make use of any leftovers so we could feed our members on a limited budget. And probably my most influential early work was a work study position at the University of Maryland Plant Research Farm in Beltsville. And it was there where I was really introduced to the hard work and joy of growing, harvesting, and eating a variety of fresh fruits and vegetables. So basically, all these experiences really solidified my desire to learn more about food and nutrition. And my interest then and now remains in community health and disease prevention. And I've been fortunate to spend really the last 30 plus years at Hopkins working to prevent and treat chronic diseases throughout the greater Baltimore area. I've participated in designing and delivering many behavioral lifestyle interventions with researchers such as Dr. Cooper and Dr. Cruz, where nutrition plays a central role in people's health. And just a little bit more about me, I really, in my free time when I'm not working, which isn't a lot of time, but I love to forage for wild edible mushrooms. And I grow herbs and leafy greens in my backyard planters. And I love to cook healthy, tasty meals for friends and family. And I'm fortunate to live in a part of the country where I have access to an abundance of fresh produce throughout most of the year. And I recognize that that is not the case for our community. So I'm looking forward to talking with you today.
Thank you. And Ms. Wells?
Hi, good afternoon. Thank you all for having me. Thank you all for listening. I will say that my family also brought me to this work. I'm a descendant of sharecroppers, and so my grandmother had a garden in her backyard growing up in New Jersey. Also, my father has chronic health issues. He has lupus that has really affected his kidneys. And so growing up, you know, his doctor used to give me, because my mom passed away when I was 8 years old, so that his doctors would give me like what he can have and what he can't have, so because I was the food maker. And so I really learned at a very young age how to make healthy meals. And that sort of has carried out throughout my life. And, you know, growing up in my grandmother's garden, I always said, when I buy a house, I'm going to have me a garden. And I failed miserably for about 6 years at trying to grow my own food. But one year I actually decided to grow lettuce. And I started with lettuce instead of starting with tomatoes. And the lettuce just grew profusely and I felt like a superhero. And I was like, I can grow anything. And so that boosted my confidence enough to start growing more vegetables and perennials as well. And, you know, that eventually led me to starting the farm that we have here in Northeast Baltimore, Bliss Meadows.
Thank you so much. So, you know, as we sort of, I think, kick off our broader discussion, Ms. Freistadt, I'm hoping you can kind of set the stage for us, kind of give us a sense of what the food environment looks like in Baltimore and what's the strategy really around the food environment.
Great. So what we know is that your food environment impacts your health. And as earlier was stated, that individual choice is only one very small component. The food environment has a very large factor, and so does poverty, income, and many other factors. So food policy and planning, we've been working on food environment mapping, and much of it in collaboration with Hopkins for the last decade. So what you'll see here in the food environment is how it's changing over time and how we're measuring it. So on the left, you'll see the healthy food priority areas. That's formerly called a food desert. And we changed the frame, but not the definition, because the residents really asked us to, because it's not naturally occurring and it's embedded in structural racism. And so to remove the name and to call it for what we need it to be, not what it's not. So with the healthy food priority areas, what you'll see here, it has 4 key factors, which is what you're seeing in red. It's really looking at poverty, access to transportation or lack of access to cars, distance to a grocery store, and most uniquely, the healthy food availability score of all the stores in the area, which is hundreds and hundreds of stores. So what's unique here is that we have used this to guide our strategy. And what's really important to understand a city strategy is there is no one solution. So we're looking at an 8-point plan on the healthy food environment strategy that takes into consideration, first and foremost, resident voice and their processes, and having them drive our processes. Looking at corner stores, supermarkets, nutrition assistance, urban ag, and transportation. So we have used these maps to create briefs, to educate policymakers. And what we learned is that we had around 146,000 residents in healthy food priority areas. And then overnight, COVID happens. And suddenly all this research and all this work we've done was irrelevant. This data was irrelevant because unemployment skyrocketed so high that these figures seemed like an underrepresentation. And so the best data that we could get at the time, which I still think is the best data in light of COVID, has been our SNAP data, formerly known as food stamps. And so we've been tracking SNAP every single month. And here on this map, you'll see approximately 1 in 3 Baltimore City residents are now on SNAP during COVID. Prior to that, it was 1 in 4. So the numbers jumped drastically, and therefore it guided our response. And so when we look at, and I'll answer more about COVID-19 a little later, but one of the key factors is because we knew the food environment, and we knew the abundance of corner stores, and we knew the lack of distance or ability to get to supermarkets, our focus was on perishable products, fruits, vegetables, meat, and dairy as a primary driver to our COVID-19 response. So we've been using our maps and our data to help us really figure out and guide our strategies moving forward.
Thank you. It's really elucidating. So you know, just sort of continuing on this conversation, Ms. Dawson, so, you know, one of the things that, you know, I think a lot of people struggle with is kind of how do they go about being able to sort of eat in a way that can help them to optimize their health. And just wondering if you could share some insights on that.
Sure, thanks, Dr. Cruz. We all know too well that what we choose to eat is shaped by many factors which lie outside of individual control, for example, genetics. But the topic of this seminar is food insecurity, the food environment policy, and marketing. We know all of those things play critical roles in the health disparities of our communities. But that said, I still believe that through food choices, we as individuals are able to optimize our health. So I'd like to start off by defining healthy eating as consuming a variety of whole foods from the major food groups while taking into account personal preferences and specific dietary needs. So what do I mean by whole foods? These are foods that typically don't require a nutrition facts label, nor do they have a list of ingredients that you need a degree in chemistry to be able to pronounce. And kind of thinking of what our earlier introductions alluded to, think of the kind of foods your grandparents ate. The major food groups, I think most people know, that includes fruits, vegetables, whole grains, nuts, beans, dairy, and animal products. And no, I'm sorry to say that chocolate is not one of the major food groups. In terms of food preferences, basically what we're talking about is what do people prefer to eat? Some people don't like the taste or texture of eggs, and that's fine. Or dairy foods might be a great source of the calcium and magnesium, but if someone's following a vegan diet, they're not going to be able to eat milk, or they're going to choose not to have milk, cheese, or yogurt to get those minerals. And then specific dietary needs, thinking of the previous example, if someone's lactose intolerant, they're going to be avoiding the dairy product food group. And if someone has diabetes, they're going to be likely just restricting their intake of fruit juices and grains as part of a carbohydrate restricted diet. But what I'd like to do now is share some factors that I think are really important to consider when you're discussing how to help someone optimize their health through diet. I would say first and foremost, pay attention to culture because it strongly impacts what people eat. It's important to pay attention to the customs from someone's cultural heritage and ethnicity. And think about your own traditions. You know, what does your family consider a meal? Does it always have to include an animal protein? Can you have breakfast foods at dinner? And it can be really empowering to tie existing traditions to healthy eating. Black beans and rice, for example, are great sources of complementary proteins. Corn beans and squash have been at the center of Native American culinary traditions for centuries. And not only do these foods complement each other nutritionally, but agriculturally as well. Religion plays a role. Red meat consumption has been linked to heart disease. And as a result, the pork industry is often marketing pork as the other white meat. But I wouldn't recommend eating it to someone who observes the dietary laws of Islam or Judaism. Taste plays a critical role. Everyone has a right to what they like and don't like to eat. I've often heard school-age children say they don't like cooked vegetables and won't eat them, when I would say in the old days when there was a school cafeteria to go to. But if you take those same kids to a local farm where they get to pick produce and maybe even help prepare a meal, they usually become much more excited and willing to eat foods from this nutrient-packed food group. Nutrition knowledge plays a big role as well. There's so much misinformation in the public domain. And again, food companies and marketing firms capitalize on that confusion. And as I heard in the poem, it's important not to blame individuals, but rather provide correct and easy to use nutrition information. You want to address food literacy. Really, it's to help people understand what to eat so that they can make the best educated food choices that are available to them. And many people, for example, don't realize that when they're trying to increase the fiber in their diet, that they need to look for whole grain bread, not just simply wheat bread. And we want to clarify the link between eating and chronic diseases. So for example, for someone that's trying to manage hypertension, what does it really mean to follow a low sodium DASH diet? And then numeracy is another aspect of nutrition knowledge, and it's that ability to interpret what people see on a nutrition facts label to determine if this is a healthy food to buy. And a packaged meal, for example, might look like it contains a reasonable amount of sodium because it says 25%. But 25% means the 25% of the daily value for that individual. And it's actually too high if someone's trying to limit their salt intake. And these are just some of the reasons why it's hard to impact blood pressure, for example, with dietary change. And food preparation, whether someone has a nutritious home-cooked meal really relies more on carryout food, depends on their confidence and their cooking skills. I can't see the audience, but I'm wondering how many of you learned about meal preparation in home economics classes. I shared earlier that my mom didn't know how to cook. We need to help people increase their self-efficacy to prepare just simple, healthy foods at home, like we saw in that video. And then the last thing that I'll mention right now is the perceived high financial cost of healthy eating. Finances and what percentage of someone's disposable income that they have to spend on food do play a big role over their choices, but believing that it's possible to, and increasing one's knowledge about how to eat healthy on a budget can really help people feel more empowered to impact their own and their family's health through diet. So those are just some of the things, and I will talk more about budget in a bit.
Thank you. That's wonderful. So Ms. Wells, your work really developing Bliss Meadows is really quite inspiring. And I'm curious if you could speak a little bit about kind of what community challenges motivated you to start Bliss Meadows.
Absolutely. So as I mentioned earlier, I'm originally from New Jersey. I moved to Baltimore to go to school. I'm a pediatric nurse by trade. And one thing that I remember vividly when I first moved down here is the lack of bodegas. Up back in Jersey, like there was a corner store everywhere where you could go, you can get a deli sandwich, you can get some fruit, you can get convenient items that you need that, you don't really, when you don't have time to go to a grocery store. But there was none of that here in Baltimore. And so I just remember driving around my neighborhood at the time, like, where's all the food? And just realizing that there was none. And at the time, I didn't know, any of the terms like food desert, food apartheid, healthy food priority areas. I just knew that we didn't have any options. And once I started learning more about most of my work really focuses on environmental education and creating equitable access to green space. And I noticed that there are so many interwoven challenges that come from systemic racism that creates the opportunity for communities of color to not have access to these things. And what I also realized, because, I visited a community garden at one point and, they just handed me a bag of vegetables and I was like, what is all this stuff? I don't even know what half of this stuff is. And if I don't know what it is, I definitely don't know how to make it. And so having access to things is not enough. Just having a grocery store is not enough for someone to start all of a sudden eating healthier. There does definitely need to be nutritional education that goes into that. What is this thing? What does it look like as it's growing on a plant? How can I turn this thing that looks ugly, at the farm stand or in the grocery store into something that I would actually want to eat and that is tasteful? Because I think there's a misperception that like eating healthy is just eating organic or eating a salad, but it's not. Like you can create the meals that are important to you culturally, that then you can make them healthier and they will still taste good.
Thank you for that. Ms. Freistadt, when we think about the pandemic, I think a question that I think is one that I'm hoping that you can address is sort of what policies for system level change do you see that's been helpful for trying to facilitate healthy eating in the setting of the pandemic?
So there's a few really large lessons learned through the pandemic. So one of our key strategies in our COVID-19 food response was really to provide produce boxes and food boxes so people could stay home and not have to go out daily to get meals. And at first we started with shelf-stable products because there was just a disruption in food supply. We just needed food in the community. The transportation was shut down. And so we started with the shelf-stable products from the Maryland Food Bank. And after the first few weeks and months, we learned very clearly that food supply started to build back up and produce was most important. So we continued to learn from those lessons that we bought all our produce. We did not rescue produce. And that was one lesson really learned, is that people want produce, but they don't want rotten or wasted secondhand produce, but fresh produce. So one is we bought all our produce and we focused in on produce. And to date, we had around 18 million pounds of food, with 78% of it on produce and perishable product. And the lesson learned on policy here, kind of getting to that, is this whole idea and concept that you need to use shelf-stable food for food assistance. We have broken that myth. We have had hundreds and hundreds of sites. Just so you know, we're moving 18,000 pounds of produce boxes a week at over 100 sites. So it can be done at scale. It can be done at a neighborhood level, and building community food resiliency, because it has been the residents and the volunteers in these communities who have been feeding every single day. And they asked us to buy the food, which is what we did. Thanks to FEMA, we were getting reimbursed for our strategy. And so I think the policy implications is fresh product is what's needed and what people want. And when it was free, everyone was able to use it. And we also had nutrition education around it. So the takeaway message is really focusing into the future of how is food is medicine? How do we launch at scale in a policy way, not a program way, Produce RX, so that if you are pre-diabetic and you go to the doctor and you're food insecure, you're getting a prescription to produce. And we really need to be able to see nutrition incentives and incentivizing produce for families who are food insecure.
Thanks. So Ms. Dawson, educate us a bit on this. So if someone has limited means, right, what are some of the strategies that they can sort of follow in order to eat healthy? And, I think in the video that was aired earlier, we saw this one example, but one of the participants today asked, how does a meal, how does a dinner, for example, under $5 sort of work for a family of three, for example? So give us some insights on how that could work. I mean, how with limited needs.
Yeah, so I was really impressed too when I first watched that video, because we saw how just in the neighborhood where Hopkins sits, that it is possible to put a meal together. Not $5, but $5.87 is still a reasonably priced meal. And before I get into some of the specifics of that, I think one of the things we had talked about, Dr. Cruz, was is it possible to even do this from a dollar store? And I know that Holly's just talked about people wanting not shelf-stable food, but like fresh produce. But let's say your only option is a dollar store. I don't know about the dollar stores right in the Hopkins or in Baltimore City area, but I thought, let me go just do a little surveillance. And I checked out what was available in my local dollar store. And I was pleasantly surprised that I could find frozen fruit and vegetables, even some frozen meat. There were canned fruits and vegetables. There was seasonings. There was nuts, pasta, canned beans, tuna, and my favorite, even some bulk popcorn. So yes, it's more challenging. You have to stay away from all the candy, soda, chips, and junk food. But it is possible to purchase ingredients in a dollar store, at least in my area, to make a healthy meal. Maybe not your optimal choice, but if that's what you have available, it can work. We know there are many obstacles to healthy eating, particularly during the pandemic. But for when you're not relying on the dollar store, I'm going to share some tips and resources that hopefully can help overcome some of those economic barriers that are faced by people in our community. As you saw in the video, planning is key. Planning out meals for the week, and particularly involving the family in any decisions about what to eat so that they're more agreeable to what's served, is going to take you a long way. And as we saw, check out store sale items and plan accordingly. You want to limit the number of trips to the store, just really basic. The running back and forth takes time and money. And again, I'm saying all this in the context of, I know things are more open now and you have availability. But I think that what COVID showed us is that if you have to go to the store once because you want to limit your exposure, you still can limit that number. Make a list. The average shopper spends about 40% more when they don't shop from a list. And shopping from your list can also help keep you from making unhealthy impulse purchases. And I like the expression, if you say no to a food in the store, you only have to say no to it once. So when you're trying to avoid chips and all that other stuff that costs money, just don't put it in your cart. Buy things in bulk, stock up on staple items that you use frequently and that aren't going to go bad. And buying larger quantity of foods such as whole grains or dried beans or even frozen and canned fruits and vegetables help you to compare unit prices, which really lets you know the cost per weight to see if it's a better deal. And this is again where numeracy comes in, but you can see that sometimes the bigger bag is not your bargain. And then things that are perishable, pre-portion and freeze them so you have access to them later. Stay away from processed foods as much as possible, because when foods are processed and packaged, you're paying extra for the manufacturing and marketing. And to illustrate that, a bag of whole potatoes is much more economical than purchasing prepared hash browns or pre-made mashed potatoes. And while they're more convenient, processed foods usually have added salt, sugar, and unhealthy fats that really cost both your health, your wallet and your health. Buy things that are frozen. I know lots of people want fresh fruits and vegetables, but frozen fruits and vegetables are usually less expensive and they last longer. And we know from, that a tiny container of blueberries, if you can find it, for example, is really expensive. So why not buy a bigger bag of frozen blueberries for the same price? And I think, as he mentioned in the video, that often vegetables and fruit are frozen when they're at their peak ripeness. So they really tend to be just as tasty. To kind of give a shout out to Atia and her farm, we want to buy produce when it's in season. Buying what's in season is not only cheaper, but it tastes better and can have more nutrients. And, again, consider things like canning or drying fresh fruit and vegetables when prices are at their lowest, or if you have more space, think about freezing those foods yourself. And then grow what you can. Yes, growing tomatoes is a little tricky. You definitely need lots of sun, but you can, if you just have a little small space, even just growing a few greens like lettuce or spinach or even herbs in containers is a great way to go. And seasoning foods with fresh herbs instead of salt not only makes your food taste better, but they're better for you. And I guess all this speaks to cooking at home. It's just less expensive than eating out. It lets you know what's in your food, and it helps you make the best choices while avoiding a lot of the unhealthy ingredients and additives that are put in takeaway foods, for example. You've heard the old saying that beans, they're good for your heart. The more you eat, well, in our case, the better for your budget. Meat's one of the most expensive items in your cart. And while protein is important, meatless meals that use beans and or nuts are equally nutritious. And we know from the research that people who eat less meat tend to have a reduced risk of cancer and cardiovascular disease. And I know this was in the newsreel recently. If Americans ate less red meat by choice, not by government force, it would also have a beneficial effect on both greenhouse gas emissions and just our resources of soil and land. Prepare ahead. You know, a lot of people say, well, I don't have time to cook. If you know you have a busy week, or cooking dinner on some nights just doesn't fit in with your family's schedule, make meals that you can eat throughout the week. On Sunday, when you have more time, consider cooking up a large pot of dried beans or prepping 5 to-go meals for the work week ahead. And I guess lastly, I just want to say that learn what else is available. You know, help people to increase resources beyond their local markets and corner stores. Consider, I don't know if everybody knows about the option of community supported agriculture, where you subscribe to getting a small portion of a local farm's harvest, and then you either pick up, in some cases they deliver weekly or bi-weekly boxes of produce. With farmers markets, you know, if they seem expensive, check them out towards the end of the day, where vendors tend to slash prices because they don't want to haul those foods back to the farm. And then be aware of organizations that fight food waste by finding a home for imperfect or the ugly fruits and vegetables that they can't sell to grocery stores. So I'm not talking about rotten fruit. I'm talking about things that have a little strange shape. And there's an organization in Baltimore called Imperfect Foods. They actually deliver foods like this throughout Baltimore, and even offer reduced price boxes for qualifying low-income families. And there's organizations that bring mature produce to distribution centers, so that's not wasted. And Food Rescue Baltimore is one that their mission is to ensure equal access to nutrition food for people in the Baltimore community. And you can just come with a bag and take what you can use. And a lot of these ideas are things that we've shared with participants in the 5+ Nuts and Beans study. I can't help but give a shout out to Dr. Cruz's project, where we're really helping people in the Baltimore area with early stage chronic kidney disease eat more fruits and vegetables and nuts and beans to improve their health. And I just hope that some of these tips will be, you know, useful to you all thinking about your community or people that you interact with. Because when we access free resources or use some of these ways of stretching existing food budgets, and with some nutrition education and skill building, it is possible for people to incorporate healthy foods into their lifestyle without breaking the bank.
Thank you so much. You provided a ton of education there, really for all of us. And, you know, in light of that, you know, Ms. Wells, I'm just wondering if you could really touch on, you know, what is the importance of educating people, you know, particularly when we think about children and youth concerning food and healthy eating habits?
Yeah, thank you. That's a good question. And one I usually answer with, what about the adults? Because in my work, I've noticed that, you know, kids eat what their grown-ups provide for them or give them. And so if the adults also aren't really savvy on, you know, what's eating healthy, then the children are likely not to be either. I recently had a conversation with a doctor's office. I think it's called Be More Farm to Clinic. And they were telling me about a survey that they ran where, you know, they gave people the option of getting fresh produce or getting an Amazon gift card. And they kept noticing that people were choosing the Amazon gift card. And when they asked why, their patients were like, well, I don't even know what any of that is, so I'm not going to use it. Or there are like other things that we don't think about, like, you know, maybe they don't have electricity at home, maybe they don't have a microwave, maybe they don't have a stove. So how are they going to prepare these foods and turn them into a meal? And so a lot of education needs to go to both, I think, to the youth and the adults on, you know, what nutrition is and how we can sort of embed that in all of our teachings. I know when I was in like 4th grade, I think they tried to teach us on how to read a nutrition label. And I was like, I don't understand this. And even when I took nutrition again in nursing school, and I was like, oh, there is just so much here. How am I supposed to like understand this enough to be able to teach it to somebody else? And so I think there needs to be a way of sort of making that sort of simpler and easier to understand, because the average person is not reading that nutrition label. And so, hold on, the chat box popped up and messed up my notes. And somebody also mentioned home economics. And I definitely do think that we need to bring home economics back. As a part of our work with Backyard Base Camp in Bliss Meadows, we do a lot of community engagement with our neighbors, and we've asked them specifically, like, what kind of programs are you interested in your children learning at the farm? And almost everybody we talked to, whether they knew each other or not, said, we want our kids to know life skills. Like, they need to understand, you know, how to cook, how to clean, how to budget. And these are things that were taught in home economics. And I think around my time, I'm aging myself, I guess, around my time in like elementary, middle, and high school is when they started phasing out home economics, but it definitely needs to come back to give these kids a sort of boost in their adulting, as they say, of how to create these meals and how to eat healthier and how to just be healthier and live healthier lives. And I will also add that when I was pregnant with my first child, I was on WIC, and the insane amount of food that they allocate to healthy options, it needs to change, because I was allotted $10 for fresh produce for the entire month. So even, as a pregnant woman, and when my daughter was born, we were only given $10 to last us the entire month. And I understand, I think they were saying that, you're supposed to supplement it with, your SNAP, but I didn't qualify for SNAP, but I qualified for WIC. And so there are like levels to policy change that Holly was alluding to that also need to happen. And I think more just like conversations need to happen between the folks who we are saying need these things, and how we can sort of, guide them to making these choices. We need to be talking to these people first, than just coming down with a hammer and saying, you need to do this. Here's what you need to do. Here's that. Here's this. We need to make it a reciprocal conversation so that we can understand where folks are coming from and what they have access to at home or wherever they are living, so that we can, again, guide them into making these healthier choices.
Thanks for that. Ms. Freistadt, did you want to weigh in or comment on that piece around
Yes,
policy?
I do. Yes. So there has been a very recent new policy as it pertains to WIC. And it is to increase the amount of fruits and vegetables specifically in the WIC package. So that is something I just wanted to note. I think that has been heard and has been changed. That was the main point I wanted to say on that one. Thank you.
And so we have a number of questions that have come up in the Q&A here, and I want to sort of pose some of them. Some of them we've already sort of covered in the discussion, but one of them was for you, Ms. Freistadt. So that was so one was around what is the city's plan for the next couple of years that the Maryland Food Bank sort of is anticipating, given that the Maryland Food Bank is anticipating increased food insecurity, where it's estimated to mean that at least 120,000 people in the city will be without regular access to food. So what's the plan, I guess, over the next 2 years is what this question is.
Great. So right now, the immediate response is our FEMA reimbursement because we're in COVID-19. And so we're getting reimbursed approximately $14 million right now to continue with the food box. And once FEMA ends, our plan is to really look at how do we transition from direct feeding, which is what we're doing in COVID and the pandemic, to community food resiliency, right? So how are we supporting the neighborhoods, whether it's from the urban farms to local small food retailers to local businesses, to support a more resilient community. As it pertains to food insecurity specifically, one component I want to note is that the Maryland Food Bank has been a phenomenal partner during COVID-19, but we've had some new partners. We have been working directly with vendors and businesses to provide the produce boxes throughout the city. And so I think another component is to continue to support our businesses who are hiring local residents to be able to provide the food. So as far as moving forward in the next 2 years, I think another very important component, and the political landscape has changed the policies. So with the Biden administration, we have already seen significant increases in SNAP benefits. The federal nutrition program has always been, it faltered. And then when Biden came in, it is now back to being one of the backbones. So we need to see continued stimulus dollars through federal benefits with cities supplementing. And that is really how we're looking moving forward.
Great. And so another question that popped up, and maybe this is one you could answer quickly, is sort of where does the protein come from that's in the Maryland Food Bank sort of food program? What's the protein?
I'm going to rephrase the question. The protein has been coming through initially through USDA Farmers to Families program through Saville Food Service. And so we've had multiple vendors providing the boxes. So that is where the primary source of protein was coming through this project.
Okay. Great. And then another person was curious about kind of the restaurant scene in Baltimore, noted that there's some amazing locally owned vegan and vegetarian restaurants, and wondering if they should become, if there should be a priority to support them towards community economic development and to try to popularize these plant-based diets. Did anyone want to weigh in on that question?
I am not a vegan or a vegetarian, so I will just preface this answer with that. But I do think definitely more support does need to be thrown towards supporting our small businesses and our restaurants, so that people do have more options if this is something that they're wanting to do. I know some folks who have become vegetarian or vegan, but they couldn't do like the cold turkey thing. So they had to sort of phase those things out, and having access to these restaurants really helped them understand the different kind of meals that they could eat, and, you know, how they can sort of prepare these things at home, and what they can begin to start substituting meat with. So the answer to that question is yes.
Mm-hmm.
And I can just comment a little bit about, again, I'm not a vegan or vegetarian either. I do follow more of a plant-based diet with small amounts of meat. And I think helping people to understand, so I won't talk about the policy and sort of the funding part, but it is kind of what are the reasons behind someone adopting that dietary approach. And if they think it's healthier, we just want to make sure that they understand it's really possible to eat very unhealthily following a diet that way. You can use a lot of, I don't know about in Baltimore, but where I am, coconut oil has just become this in vogue way of adding, and I even saw it in our video, and nothing has changed about coconut oil being a source of saturated fat that's going to raise cholesterol and risk for heart disease. But so it's kind of things like that to make sure that people understand, you know, if you're, we know that we have issues with undernutrition, but over calorie intake. And so it is possible to increase obesity, rates of obesity, even if you're eating a vegetarian diet or vegan diet. So I think it's about education as well. So that's not the responsibility necessarily of the restaurant, but I think understanding why people are looking for those things, and then making sure that what they're being served, or even just there's maybe some nutrition information available so that people aren't thinking they're being healthier and actually doing some disservice to their overall health.
I think that's a great point. So there are a couple of questions in the Q&A box here, sort of related to education, right? And particularly with a focus on children and sort of elementary and high school age children. So one is around, certainly that nutritional education is a really important approach to try to incentivize people around adopting healthy food choices. Are there any governmental supported programs in Maryland that are sort of addressing a curriculum around this? And in a related question, would support from different medical societies and academics help to change any of these policies around the type of education that's occurring for children in the school system? So maybe I'll turn to you for that, Ms. Freistadt.
Yeah. So I want to first do a shout out to City Schools and to Great Kids Farm. We have a phenomenal farm that is providing farm and nutrition education to Baltimore City Schools as a part of the school district. So please do check out their work. And so one of the key, and we also have a farm to school team at City Schools who are working with teachers even during COVID and prior, to be able to learn how to do outdoor classrooms and planting and container gardens, to really teach nutrition through gardening and cooking. So I think that is one mechanism. And then we've also seen a tremendous amount of work over the years on SNAP Ed, which is the education component to food stamps, where they've been working in Extension. I want to shout out to Extension there, has been doing tremendous work with youth in the school system, teaching nutrition experientially through cooking and gardening as well.
Mm-hmm.
Can I add to that a little bit? As a parent who has kids in the city school systems, yes, we do have Great Kids Farm, but I also think that there definitely needs to be more pressure put on the school system as a whole, because those programs exist for the schools that choose them. It's not a one-all, like everybody gets it. Like the schools need to seek them out. And so if it's something that is going to be sort of that is like held at the district level to say that every school gets this, every school must have it, every school needs it, then I think we will start to see change. But as of right now, Baltimore's especially with the charter schools, like they have more free agency in how they build their curriculums and things like that. So they have these options. And so it is an option, it's not mandatory is what I'm trying to say. And that it needs to be something that is mandated or should be.
Hmm. Thanks for adding that. So there was a question that had come up. It came up during the video that we watched earlier that highlighted Save a Lot, right? That was featured in the video. And the question was, now that Save a Lot no longer exists in our community, what do we do? And so maybe open that as a broad question around, the issue of there being so many of these full-scale supermarkets that have closed. In a number of communities around Baltimore. Just wondering if anyone wanted to weigh in on thoughts on what individuals even should do given that circumstance.
So I can speak to this from more the policy side. So we're going back to the healthy food environment strategy. Supermarket attraction and retention is one component, but we know a couple key things. One is most people do not shop at the closest grocery store. Two is on average, people shop at 2 to 3 stores. So the thought of bringing a store in, like a Save a Lot, came in, but it did not stay, right? And so when we look at the solutions, we have to be looking at, we're launched and piloting a rideshare pilot for residents to be able to get to supermarkets wherever they want. People want to go to the store they want to go to. So we need to help people go to where they want to go and not force a certain store in certain neighborhoods. So I think that is one piece. As far as the answer, we've been working on a policy that finally has, after 10 years, has finally come to play. Still is not perfect by any means, is online SNAP. So now if you're on SNAP, you can order online, and it just started during the pandemic. It definitely needs to improve, but it's a good foundation so that people do not need to only depend on brick and mortar in their neighborhoods.
Great, thanks for that. Were you going to chime in, Ms. Dawson? Okay.
I was just going to say that, I know from our experience, and again, in the project that I'm working on with you, Deidre, where we actually have worked with a local store, ShopRite, to deliver food and to deliver it in the first case to sort of to one local area where participants in a research study came in, but because of COVID, we've had to have alternate methods of having the foods delivered to them. And I think, most of these programs do charge for delivery. So if there was a way to kind of waive that charge or have them get some reimbursement, have the stores get reimbursement so they don't pass that additional fee on to consumers, that also might be an interesting option to explore.
Yeah, so another question came in, and I'm going to take moderator's privilege and maybe add a little bit to it. So the question that came in is, how much is SNAP for a family of 4? And I want to maybe add a little bit to that, as we think about this topic of sort of healthy eating, and I'm curious, and this will. Maybe we can first start with you, Ms. Freistadt, again on this one, but where are we in Baltimore around thinking about how to support or incentivize healthier choices for people who are receiving the SNAP benefit? Just want to tag that on to the question that's asked.
Okay, so the first part of the question was, or used to be, a very easy answer. I could have told you how much SNAP for a family of 4 without even blinking, but then COVID has hit and the numbers have been changing based off of the dollars. So I can't give you the exact answer. I don't want to say it incorrectly right now, because right now during COVID, people who are on SNAP are able to have more dollars coming in and they're able to get maximum benefit. So we have to do a follow-up on the exact amount. It's somewhere ranging between 400 and way plus that, but I can't give you an exact number because I have to look it up. It's changing. As far as incentives, there is quite a bit nutrition incentives at the farmers market. If you use SNAP or federal nutrition assistance, you can get incentivized. Same with some CSAs and farm stands. We're trying to see launch of the program you were just talking about, related to the farm and the clinic. But one of the key ways is to incentivize by spending a certain amount of dollars using SNAP, and then you get remaining for fresh products. So I think some of those are the key ways to incentivize, to encourage people. Or one of the key things we know is that the majority of people who are limited in consumption of fruit and vegetables, oftentimes it's dictated by price, so by just increasing the incentives so that they can buy more with the same dollars, we're seeing significant changes in consumption rates.
Great. And so maybe I'll add another question, certainly invite others in the audience to continue to add questions to the Q&A. So we've talked a bit about that, and I think it was you, Ms. Wells, that really pointed out that the food itself is certainly necessary, but by itself may not be sufficient for people to actually know how to prepare the foods. And so just wondering, really again, where any of you may see opportunities for programs such as SNAP to really address that sort of important piece of the pie, the sort of what to do with the food once maybe you're able to get it.
Yeah, I can start with a program that we are thinking of possibly launching this summer. And so it's basically just giving out recipe cards. And so we were receiving the boxes that Holly was talking about earlier, and we were distributing those to our community. And since we were hand delivering those boxes, we had the opportunity to sort of open the boxes up, go over what was in each box. Folks had questions like, what's that? Okay, what am I supposed to do with it? And we did that in real time. So being that we grow our own produce at the farm, we're able to know what we have available and, what's coming up for harvest. And so we can create these recipe cards and say, okay, well, now we have collard greens available, and these are some recipes that you can put collards in. Or, we're going to be harvesting our potatoes. These are the kind of potatoes we have. This is what they're really good at. Because another thing that we've noticed, oh no, I need to charge my computer. One thing that we've noticed is that, there are different types of potatoes and different types of onions go with different types of meals. So you can't say, you put the same onion in this type of meal that you put in that meal. So we'll have to sort of curate those a little bit better so that people get the taste profiles. I sound like I'm on the Food Network. So that people get the taste profiles to really help them want to create that meal again. And we also offer cooking classes on site. And so, the produce that we harvest it, we have our little hot plate set up, and we're able to provide a cooking class in real time for folks who are coming through to our farm stand. Also, we have applied to get SNAP benefits at our farm stand. It's taken 18,000 months, but we're still in process. Hopefully we'll get approved sooner rather than later so that we can have that as another offer for our neighbors. And we, as an organization, have allocated 10% of everything we grow to be donated to our community if they need it. So most of the stuff we don't even charge for, people just come and pick it themselves.
Thanks for that. So a few more questions came in. So one is around whether, and maybe this is for you, Ms. Freistadt, lots of policy questions, but has Baltimore looked into providing low-cost retail space for fresh food and or providing space in neighborhoods for farmers markets?
So several years ago, we passed a piece of legislation for a grocery incentive tax credit to bring grocery stores in to the city in healthy food priority areas, but in all honesty, most importantly, to allow them to renovate and to continue to improve their stores over time, because that was one of the limiting factors of why stores were going out of business, is that they weren't renovating on a regular basis. So we do have that tax credit specifically in and surrounding healthy food priority areas. As far as farmers markets are concerned, we do have that to allow for farmers markets all throughout the city, and also for farm stands to be able to sell their produce. And that was a change in the zoning code. And we were also able to change our building code to allow for all the hoop houses we now have in the city. So there has been changes from the policy. Also a policy change we did to allow for animal regs, so we can have bees and goats and chickens and so forth in the city. So I think there's been multiple policies to allow for more food retail, but also agricultural purposes.
Wonderful. And so one question that came, I'm going to add a slight spin to it and offer it to you, Ms. Dawson. But the question is surrounding the fact that food choices are so deeply personal, and that and this participant noted that they appreciate the comments around cultural relevancy, but they're wondering if we could elaborate a bit more on how these different cultural aspects can be addressed and balanced. And their question was around food assistance programs. And Ms. Freistadt, I'll pull you into this in a moment. But I'm wondering, Ms. Dawson, given your work in a number of different research studies that have really tailored the diets that are being, or the dietary patterns that are being promoted to the population that is being that is the focus of the research studies, if you could touch on kind of how those sort of nutritional education approaches go about being culturally appropriate or culturally palatable, really for the audience that you're targeting. I hope my question made sense.
Yeah, it's a great question, right? Food is one of the things, and those of you that have had children know that they have control over, whether they're going to eat it or not, right? They can shut that mouth really tight. I'm not going to eat it. It just doesn't taste good, or it looks weird. And I think from the very beginning that what preferences need to be honored and acknowledged. I think, when we talk about respecting and disparities, that whether it's at an individual level, at a racial or a cultural level, what someone chooses to eat really is, we need to honor that in how we approach them. But you could say that said, if let's say your desire is to make sure you get more potassium in your diet because your doctor told you that's really important for managing your kidney disease, right? Explaining to people where potassium is found in foods, right? So it's in white potatoes, it's in sweet potatoes, it's in greens. If someone pushes back and it's like, well, I don't like greens, then you give them other options, right? So that it's both, you couch the education and this is what we know, but what's more important is how is this relevant for you? And like I said, the example before, if a meal doesn't feel complete, if you don't have an animal protein, some people at dinner is just not dinner if you don't have meat, potatoes, and a vegetable. For other people, then you work with that. Like, can you figure out a way to use less meat, like we saw in the video, but make your vegetables and your starch more of the central role. But I think we want to always acknowledge that people do have the ability to choose, and give them the best information so that they can make the smartest choice for them, given that. I don't know if that really answered it, Dr. Cruz, for you.
Yeah, no, I think it did. And Ms. Freistadt, did you want to touch? Oh, sorry, go ahead. Go ahead.
On the cultural relevancy of food and trying to make them culturally palatable. So one thing that is, I wouldn't say unique, but one thing that we do here is, since we do a lot of community engagement, we have these relationships with our neighbors. And so we know where they come from culturally. And so we're able to have those conversations. Again, like, I'm really big on relationships, if you can't tell. And so just building that relationship with people to really ask them, like, what kind of food do you eat? And this has been a part of our most recent survey, which is driving what we're growing at the farm right now. Where we've asked our neighbors, what kind of foods do they eat culturally, and that's what we're growing right now. And so being able to know where those people are. So we have like a large population of refugees from Bhutan here. And so if we're able to ask them what kind of foods they eat and how they prepare them, we can then look at that and figure out how we can make changes to it. And they can still use the spices and things that they use, and it's healthier, but still has that familiar taste of what they're looking for.
Did you
I
want
think
to
that's-
weigh in from the policy standpoint there? Oh, sorry.
I just
Go
want to
ahead.
add one more thing that I think it's such an important point is really not assuming, right? Like asking, the knowledge is with the people, right? So what do they like? What don't they like? What works? And I think that's so central because I think we get ourselves into trouble if we make assumptions and figuring out what works. And then within that context, say, oh, okay, great. So you've got diabetes and now you really do like cassava and you like potatoes. And so let's see if we can't figure out how to make smaller portions of them so you're not getting too much carbohydrate at one meal, so that you still work with where people are, but then share the additional information as needed.
Great. And from a policy standpoint, like how can these considerations be incorporated into these food assistance programs? I think was the main thrust of the question.
So for one of them on the city side, for city policy, we actually have a changed wellness policy for city employees, depending on the labor union, where we can use our wellness incentive to join a CSA. And we need to see more corporations and healthcare institutions to be able to allow for wellness incentives to support CSAs and being able to buy fruits and vegetables from local farms. So that's just a local policy. I think one of the frameworks of a lot of the federal policy has been choice, right? Like SNAP is actually about choice. It's not a nutrition program, it's a supplemental program. But where I think some of the greatest challenges has not been about the limitation of choice, like with SNAP, it's the process to be able to get on and stay on and the bureaucracy of SNAP that is limiting people to be able to use SNAP. So I think sometimes it's about choice with the federal benefits. WIC was different because WIC is a federal program that is about nutrition. It's a nutrition program. But a lot of the other ones are not necessarily, and it needs to be very easy to access. And so that we don't see what we see is a lot of ebb and flow of SNAP. You get on, you get off, you get on, you get off, you get disqualified, you get on. And with federal benefits, it really should be, if you're low income, you can have access to it. And it's not as difficult as it is right now with all the red tape.
Mm-hmm. So there were some questions that that came in, I think, prior to the session today. Actually, some previously submitted questions. One of them is one surrounding that, there is food that's being given away through a number of different programs that we've touched on today, but that there are some people who actually can't carry the heavy boxes or just can't kind of get to the locations. And so just wondering if any of you, I see Ms. Freistadt smiling, so I'm thinking she knows something about this, but just wondering if you wanted to comment maybe on that issue.
Yeah, so this has actually been a huge issue with COVID, right? Because in COVID, we've needed to be able to use everything boxed because it's COVID and we can't have everyone picking the food that they want. So we've had to create these boxes. And also we know the level of food insecurity in being able to get the amount of food. So with the Maryland Food Bank box, that's a 30-pound box. And so that has been a challenge for many. And so what we have ended up doing there is we have home delivered boxes for those who are homebound for the Maryland Food Bank box, and Amazon has been pro bono and others to be able to drive those boxes. And then we changed to, this is just COVID-19 response, to be clear. And then now we have two different produce size boxes, one that is 12 pounds or 10 pounds and one that is 20 pounds. To be able to have variation. But there has been this struggle between getting people the most amount of food possible because they're food insecure in a pandemic, mm-hmm. and the weight of the boxes. And it's always been a balance. And that's why our older adult strategy is different, where it is more focused to home delivered boxes.
Understood. There was one, I think it was more of a comment maybe out to those who are community leaders who are joining us today. And this person is just advocating and encouraging communities to advocate for markets in their community, such as what happened in Gwynn Oak, where they were able to get a ShopRite instead of a drugstore, Rite Aid drugstore, and that they noted that supermarkets tend to follow communities who have perceived wealth in general. And so that was just, I think, an important comment to share. One, maybe a quick question. A person had a question about, and this would go to Ms. Dawson, I think. So wondering about pesticides. Do we need to worry about that their sort of foods exposure to pesticides? Can that have an impact on health?
So it's a really important question, and I'm gonna, it's not my area of expertise in terms of, yeah, there's residue, right? So, and that's why a lot of people are moving towards eating organically if they can, but we all know that that's more expensive. I'm gonna give a shout out to the Center for Livable Future at Hopkins, where they really taught, it's an incredible resource of material for just talking about the food system. And actually, I'm currently taking one of their Coursera courses on an introduction to the US food system, where it really talks about soil and sustainability and resiliency and what using pesticides does and doesn't do both to the soil and the food supply. And so I don't want to call them an evil ingredient that farmers add, and I'd be curious to see Atia's response to this. But you know, it's a bigger issue of just how do we get the most food from the land and the reasons and water that we have available to us. So that was me dodging the specifically. Pesticides are not really good for human beings, but how do we limit them?
Yeah, Ms. Wells, did you want to weigh in on that? Is that something within your work?
Yeah, pesticides are definitely not healthy for you. We don't use pesticides or herbicides or anything like that because we keep bees also on our site, and so we want to keep them alive and healthy. We also have a fairly large native wildflower meadow that we've seeded, and so we want to ensure that all the pollinators sort of survive. And we also have 7 acres of woods behind us that are home to a lot of wildlife and hawks and owls and things like that, and that pesticides sort of get traveled through. So if, you know, say, for instance, like a rodent ate a bug and then the hawk ate the rodent, then that hawk now has those pesticides within that body and it can kill them. And so, I mean, we aren't certified organic or certified naturally grown or anything. We just do not use any types of spray.
Mm-hmm. Great. And so there is a question, and this may be our final one. It's surrounding whether there are concerns that counseling is difficult to promote as it requires time and trust, and that there are some community members who may decide to see a nutritionist. And I guess the question is, you know, have there been outreach efforts performed by professionals in nutrition, I guess, to sort of maybe address some of these issues that we've been talking about today surrounding food insecurity and kind of access to helpful foods more broadly?
I'll just jump in. I don't think I've heard specifically of nutritionists doing community outreach type things. What I have seen are, you know, like virtual cooking classes or some other sort of offerings that happen, and it's like the people who come get that knowledge. Because again, we're very relationship based. We like to bring things to people. We do not like the model where it's like, okay, we're going to offer this thing, we'll invite you to it, and then like if you show up, you receive this knowledge. We're very much like bringing it to people's doors. And we actually, across the street from the farm, we actually have a certified nutritionist. And so like she's been able to sort of provide the community and the neighborhood with some of these, with some of this knowledge as well. So I do know though that relationships do take time. And I feel like it is just, maybe it's just, you know, American culture that like everything has to happen now. But there is the opportunity again to slow down and sort of meet people where they are, and then like figure out how you can get to common ground and not like you need to eat healthy today. It needs to really be a progression.
Mm-hmm. Fantastic. Go ahead. Ms. Dawson, you were going to
Yeah,
ask?
I was going to say that in the old days that nutritionists often would be invited to larger markets to do grocery tours, right? So they could talk about how do you find, I actually did one here where it was funded by the diabetes organization, because they really were gearing it towards how do you help people make food choices in the market, because unfortunately, there's so much misinformation, and people want to hear the most dynamic, maybe an actor or a celebrity talking, and they don't always give the right information. So I think nutrition's not very exciting and sexy, and that doesn't sell. What does sell is, eat this, have this green tea and you're going to lose 50 pounds. So I think it's just challenging to, we don't have the most exciting thing to share, but how, kind of building on what Tia was saying, is how do you put nutritionists in places where they're going to hear or where people are going to hear what they need to hear. And I know that we had a project with Dr. Cooper where we embedded some nutritionists in some of the Johns Hopkins community physician practices. So it's sort of like where there's a lot of detail about sort of who gets reimbursed, and we are a professional group, so there is that piece as well. So I don't know, I think it's a great idea though, because it's like, how do you get us out in the front as opposed to people that are spreading things that maybe are not as truthful or helpful to the community.
Yeah, well, it's interesting to end on really highlighting the dangers of misinformation, because I think all three of you have really given us some fantastic information today. And so I want to thank you, and also to thank the participants for your wonderful questions and for your engagement. And so to summarize today's events, I'm really excited to turn things over to Lauren Green from Dancing with Markers, who will present today's graphic recording.
Thank you so much. And it's just going to take me a minute here to get my iPad pulled up. So meanwhile, take a look at the chat. I know the screen's blurry. Don't worry. I'm going to tell you what to write in the chat, and then I'm going to turn on the video in a second. But think about, what is one key takeaway that you have from today's event that you are going to carry with you into the future? And to help you remember, I'm going to play a little video. I know it's not super high resolution, but you'll get this after the fact. What is one key takeaway that you're going to carry forward into the future from today's conversation? And go ahead and put it in the actual chat rather than the Q&A. Certainly enjoyed the $5 challenge. I think I enjoyed also that he didn't actually make it $5, but he owned it. Eating healthy takes a village. Thank you. The three-legged stool of programs, education, and policy that are needed to address food inequity and nutrition. Teaching children to cook for a healthy living. And make sure you've selected to send it to all panelists and attendees so we can all read your key takeaways. I always hope that these visual notes serve as a way to quickly remember the conversation and the information at a high level. So you will definitely get a copy of this, and I believe it's going out on social media as well. So you can reshare it and send it to friends or family who may be able to benefit from the wonderful information and tips that were shared. And so while this closes out, I will hand it back over to Dr. Cooper, I believe, to wrap us up for today. Is that right?
Yes, that is right. And this is just so beautiful. I'm so excited. And we have 3 of these now, and they're just going to be wonderful because there's nothing more helpful than having a beautiful sort of artistic, like an image to just help you to, remember a very exciting and insightful day and discussion. So I just want to thank our fabulous moderator, Dr. Deidre Cruz. I'd like to thank our brilliant panelists, Ms. Holly Freistadt, Ms. Arlene Dawson, and Ms. Atia Wells for engaging in such an important discussion about the role of food. I learned a lot. I don't think I could say it much better than what's already been said, but I know I definitely heard some key points about the importance of family and culture and basically and the importance of food in terms of its building relationships and community, the fact that we have to give people choices and voices around their food and provide supports and education for them. Just so many exciting things. And I actually am a fan of those like one plate or one bowl meal. So that was a really practical tip. And we got a lot of really practical tips today too, which I think are going to be very important for takeaways for later. So that was sort of my little wrap up of today, even though I'm sure our panelists and our graphic recorder did a much better job than I did. But I wanted to make a few points before we closed out. First of all, several people were asking in the chat if there was going to be a link to the recordings from these sessions. And yes, there will be. We will send those out. And if you need a transcript, we can send you a transcript if you would like as well. So also the other thing is we're going to send you a brief survey after this. We ask you to please complete it because that helps us in our future planning, make sure that we can continue to meet your needs. And the only other thing I will say is that we have one more day this week of our conference. So we're really looking forward to tomorrow's session, which will be focused on housing and health, safe, healthy, affordable housing in vibrant communities, investing in housing. So I'm looking forward to seeing many of you there. We're going to be starting at 1 o'clock. You can still register for that final day of our 4-day symposium. So again, thank you to all of you. And then also, of course, to our amazing staff, Natalie Wiggins, Imani West, and Nancy Edwards Malello. And then we also have Ms. Chioma Onua, who has been doing an amazing job on the chat function. And then again, of course, Ms. Lauren Green, Dancing with Markers. Thank you all so much and have a wonderful rest of the day. We'll see you tomorrow.